Hello, good afternoon. I am Dr. Vivek. Today, the topic which I am going to tell you is about Glasgow Coma Scale. What is Glasgow Coma Scale? Whenever a patient with unconsciousness or reduced consciousness comes to hospital, first we assess commonly is Glasgow Coma Scale. So, what are the components of Glasgow Coma Scale? So, there are three components of Glasgow Coma Scale. One is eye component, second is verbal, third is motor. So the total score in this Glasgow Coma Scale is 15. So minimum score is 3. So the consciousness is between 3 to 15. So let's go and see what are the component of Glasgow Coma Scale. So first is whenever a patient comes, is lying on the bed and patient says he is not conscious, then we assess Glasgow Coma Scale. So it includes, first one is I. E is I. It has 4 components. Then P5, that is verbal. It has 5. I has 4, verbal has 5, and motor has 6 components. So what are the component of I? So whenever a patient comes, he is lying on the bed, I'll go and see the patient. So that time we'll see whether the person is opening his eye. I'll call his name, and if he opens his eye spontaneously, then the score is 1 out of 4. Then if we call out his name, and if he opens the eyes and he's not opening spontaneously, then it is to speech, means to my speech he is opening his eyes. Next one is to pen. Even after calling, if the patient is not opening his eyes, then we are going to call it as opening eye to pen. We pinch in the painful area and see for the response to pain. And even after pain, if the patient is not opening his eye, then we give the score of 1. That is number 1, 2, 3, 4. Score 1. This is eye component. Next one is verbal component. Verbal components means the patient is in coma, so he is not talking. And so the person comes, I will assess verbal component. So after talking to him, sometimes he might be drowsy. So we'll see whether he is oriented to time, place, and person. Where is he? What time is it? Which place he is? Time, place, and person. So the score is 1. Then the patient is confused. He doesn't know, not oriented to time, place, and person. Then I give score 4. Then he will talk inappropriate words. Means he will not be oriented, but he will be having inappropriate behaving inappropriately. Then next is incomprehensible word. Means the word which he is telling, he will not understand only what he is. He will just make sound. Next is no response. Patient is not responding to sounds. So there are 5 components: 1, 2, 3, 4, 5. So depending on what is the verbal response, we score it from 1 to 5. Next, finally, we go into motor. Motor means the patient in coma is not moving. So if he is moving, then he will obey my command. If he obeys my command, the score is 6. There are 6 components. So he obeys command. Then if he is not obeying command, so we are coming from here. Verbally is not obeying command, then I will pinch him. If he moves his hand to the painful stimulus, then he is obeying. Then if there is pain and if he flexes his limb, then it is M3. Then abnormally withdraws the hand, not fully, then it is M4. And there is after pinching he flexes out his hand, then it is abnormal extension. So M5, and last is no response, that is M6. So there are E4, B5, M6. So score below 3, the patient is not responsive to eye command, verbal, and motor. So score is 3. Minimum score is 3 means the patient is not responsive. So when we call it as coma? When the GCS score is below 8 or sometimes below 7, it is called as coma. So below GCS 7, it is one of the indicator for intubation. So this is the Glasgow Coma Scale.